shaping the future of pediatrics is very important. So in this case, going with the innovation and patents and also a lot of trends that has to be created by this is very important. So when we talk about the technology that has been rising in a par at a par increase in speed, I think we need to go with that. So we have to continue that. So we have to access the accessibility of the care, the quality of the care has to be improved in parallel with the rising technology. So in today's fast-paced and also ever-changing healthcare scenario that is happening, we all should know the advancement of the technology is very important because that has to be combined with the innovation only. So that innovation can be in the clinical area, and this innovation, when you do itself, you know very well, education and research is very important. It cannot be separated. So education, research, and clinicals, three are inseparable. So with the education and research only, we can go with the innovation that could be put into practice. So the evidence-based practice comes over that. So this is very important to improve the health and well-being of the children who are around the world, and we can save many lives of the children with this. So there is a recent study which has been done in 2023 where they found there are a lot of trends that has come, and like there are impact of this particular 10 trends have been come, and these had created a lot of innovations in the pediatric healthcare. So, for example, the artificial intelligence, which is going to be the maximum, it has come to 22%. So when we see to that, the next one, it is the child health monitoring, the diagnostics, very important. The precision in diagnostics is more important. And also we need to go with the that is coming to the 11%. And also we have the mobile health apps, which is coming to 11%. Again, we have the advanced visualization where we are trying to bring the augmented and virtual reality also. The AI is also combined. So everything is combined with the AI and digital platform. We need to go with the AI. That is very important. Similarly, that is digestive supplements, which has come. That is 9%. Also, we have pediatric EHRs, that is electronic health records, because initially we are using it for the adults, but slowly it has been included for the pediatrics also. And telemedicine, that is for 6%, especially after the COVID pandemic. This telemedicine in pediatric healthcare also has started to have a lot of importance. And we have the infant ventilators, which is a very non-invasive and very small one, which is portable. That is 5%. And we have clinical management system, that is 5%. So without health informatics, we are not going to do anything. So HI tools are very important, which is being used day to day. And it's for the digital health, we need to go with the HI tools. So clinical management system is very, very important. So when we talk about this, the computer assisted care, so where we are going to with the hospital, so artificial intelligence is going to play a very important impact, especially in the pediatric medicine and surgical field. So the computer assisted care is very important. So where we are going to use the machine learning, because when we are going to when you go for the data, so especially the data compilation or the data computation, also the lab technology, especially the lab technicians, we don't know whether the precision in the measurement of the lab data is being given to us. So the machine learning is very, very important. At the same time, the deep learning is going to be very important, which is going to give the solutions for all this. So here we can see there are many insights when we talk about this particular artificial intelligence. It is bringing a lot of insight into the patient conditions and diseases. And it is very, especially the precision. I told them the word precision. So it is helping us to go with the accurate diagnosis, because with the accurate diagnosis only we can go. So you don't want to waste your time, don't want to waste your money, don't want to waste the energy. So when you are going to make an accurate diagnosis, accurate treatment is given, and this is going to help the proper prognosis and management will be done, which is going to save the life of the child, as well as don't need to go, because when you are going to go with a confused diagnosis, or we are initially, I think we all know very well, provisional diagnosis, because we are not sure which is the diagnosis until we are getting confirmed. We have to do multiple interventional technologies, or we have to go with the therapeutic like a what to say, like interventional or the diagnostic modalities has to be used more, so that we need to find out, we have to come to the conclusion. But here, when you use AI, there is no need to go with it. We can go with the accurate diagnosis, which is going to help in the treatment. So it is going to give a personalized wellness content, because where the child is going to get a proper content by themselves, where the child's lifestyle will be completely changed. The child and the adolescent can become a responsible human being for their own self health, as well as it's going to help in supporting the mental health of the children, because that is going to be devastating the children, because during this childhood period, where they are more going for this mental health problems only. Also, it is going to accelerate the data flow, because the processing workflow, all that the kind of computation works could be done easily. Automatically, the operations can be done, especially in terms of child monitoring and patient scheduling activities. Similarly, it also helps in predicting, because the child is going to be can predict the mortality rate, because that is also a great one, because we have to go for a big survey and all. So many no need to do. We can go with the mortality rate of prediction. Survival also, we can see how many survey or what is the survival chance. As well as we can also, this is very important because it's going to go with the trends, the current trends of health trends, and especially vital events, how to monitor that the way, especially in case of preterm birth, because that is a very important cause of for mortality and morbidity in the children. So we can even go for predicting this. So when you talk about the apps that has been developed now, which has come as a current innovation, the top innovations in AI field, Zola develops an AI-powered mental wellness companion. So this is one type of app. So where it is going to detect the mental stressors. Also, it is going to help in building the resilience and strength. Especially, it is going to give a very good generate a specific insights, where it was also going to give a recommendations for the school teachers, school students, the pupils, as well as the parents, especially in terms of mental health support. Also, it is allowing them to take a proper action, especially in the structural, organizational level, as well as in the personal level. That's what I told the person, the child themselves can become a responsible citizens who's going to take care of their own health and others' health too. So here, there is another one AI innovation which has come, that is Pediatrics provide, that is especially it's going to provide a computer vision powered child monitoring. So here when we see the child health and measurement monitoring could be done, which is going to use the AI. Artificial intelligence is going to be used that. Here also we have two types of apps, startup apps. So whenever we are talking about the innovation, need to we need to know two things: startups and scale ups. So starting up is very, very important. So startups are any companies or anything which can help us to go with the funding, and we are going to go with the startups with the proposals, and we need to use our knowledge. Whereas scaling up is very much very important, is how we are going to go with the propaganda, and how we are going to go with the marketing, and how we are going to go with this utilization. So here also we have the startups apps, and also the soft spots could be used. So here the healthcare professionals and also the patients, they can upload the images, they can upload the videos, and also they are able to, the app is helping to generate all the reports, and this is helping to go with the timely interventions. So this is what we can do. So next one is we are having other, that is like a child health monitoring one, where we can go with the that is going to help in going with the health related data, where we can go for all the healthcare professionals, and the parents also can use this particular child health monitoring app. So this is helping to find out it is helping in aiding the child disease and the treatment. So there is a lot of variables. We know very well. Nowadays, we all are having the smart watches, and nowadays there is a garments. So recently also, I have taken one journal club presentation where I found in newborns, there are a lot of the clothing, the textiles. There is a neonatal newborn textile, that is the textiles or the garments which could be worn, and that is going to track. So also there is headgears that could be worn, and these are going to give us the health related data, so that the sleeping pattern, the heart rate, all the vital events could be calculated from this, or could be monitored by this. Also, there are healthcare pros. Also, there are many startups that are going to use a platform called as gamification platform. So I know, even I think you all know very well, in case of our educational field also, now we have gone with many gamification platforms. For example, Bingo. So it is also one type of gamification platform which could be used for the nursing education, where the children also jigsaw method. Jigsaw method is very beautiful method. I think more than like a bingo, I think that will be very interesting for the students, how they can sit in a group and interaction. They see all that what we say. The children can very much improve in their communication as well as interaction. So that is going to help them in all the broader aspect, the holistic approach, holistic aspect that will be done here. Also, we are going with the like where we can go with the patient engagement. We can engage the patients, as well as we can make the data acquisition very simplified one. Smart pills, we all know very well. This is going to use a sensor, and most of the time when it started, it was talking to measure. It was supposed to measure the gut, so the full gut was measured, monitored using the smart pill, which is helping us to find out any problems in the intestine GI system. So this particular is going to help in prescription timing data. Also, it's going to be very helpful for giving a precision data. So next one is when we talk about that, we can see other top innovations. What we can see is Oxyprem, that is makes an oxygen monitoring head here. So this is also a type of monitoring one. So where we can see the brain oxygen monitoring could be done for the newborn, especially if there is going to be a head injury, and it is going to be a non-invasive reusable tissue oximeter. So it is a very small one, very micro one, which can be used. So it is going to use a NIR, that is near infrared spectroscopy, and it is going to be very non-invasive, no need to do anything. So it is going to monitor the tissues, and it is going to tell about the tissue health. So this is going to be very useful for the children with the head abnormalities or the brain injuries, head injuries. And coming to the another one innovation, that is first day healthcare, that is going to simplify the remote patient monitoring. So we can see the wireless sensors, which is going to send the data, especially regarding the vital signs, the oxygen saturation. So it is going. Hello.
Hello.
Oh, I'm sorry. I'm sorry. I think
I
I'm
yes,
just
ma'am. You
sharing
lost
again.
your screen scale. Yes, ma'am. Recovered.
Is it okay now?
Yes, ma'am. Yes, ma'am. Please put in slide share.
No?
Ma'am, please put in
Oh,
slide share.
yeah, I have put it in slide share only. No,
Yes,
I
ma'am.
put it in slide share. Okay.
Yes, ma'am. It's okay now, ma'am.
This is the problem now because when the time goes off, the internet stability goes off. Okay. So we can see the first day healthcare simplifies remote patient monitoring. It is mainly going to, it's like a cloud storage where the data can be stored, and we are going to this platform is going to be helpful. So where the parents can use the smartphone apps itself and they can store the data. So the big data can be stored with this cloud storage. Also, I think we all are having nowadays. Also, the hospitals also, it's going to be very helpful for them because they can also manage the child safety could be done even after the discharge also, this could be used. Also, because as it is going to be used, we can even reduce the readmissions, like from the NICU to home. That is data is going to be very helpful for the parents, and they can use it. And coming to the other one, that is the when we talk about the so here. So when we talk about the other things like a pediatric disease diagnostics, so next to the child health monitoring, this is where we are going to with the genetic test, the genomes. So where we are going to identify the genetic mutations, and also it is going to talk about the like a lot of associated conditions like sickle cell diseases and Down syndrome could be easily targeted, and this could be the treatment modalities, also the rehabilitation could be done. So here the point of care and portable diagnostic devices are going to be used because it's going to be a great interest for the care providers and the parents, and also the care can be decentralized, and also the care could be accelerated. A proper care could be rendered. Similarly, the top innovations with regard to the diagnostics are like neometrics diagnostics that is going to offer an automated in vitro diagnostic device. It is going to develop a AL4 diagnostics. So that is going to be automated in vitro diagnostic device. It is going to integrate the robotic services here. And also it is going to go with the other things like multi-wavelength spectrophotometer, and that is going to test the bilirubin level. So actual bilirubin level. So the children newborn with hyperbilirubinemia, no need to worry at all. This could be very easily, it can monitor the bilirubin level, and also it is going to use, and same time, it is also going to use a algorithm, and this particular algorithm is going to give you the completely what is the bilirubin binding capacity of for the newborn. So this the bilirubin level will be completely accurately monitored, and that is helping in the treatment of the child. And this is going to go with a proper treatment and good prognosis in the newborn with a hyperbilirubinemia. And coming to the next one, that is Curie DX enables AI-driven medical diagnosis. So here the smartphone, that smartphone can be useful where we can upload the photos of the children, and also it could be screened, especially in case of any common diseases like the child is having rashes or some kind of skin problems, that could be taken and it could be shared. And also this is helping in the like we can use the telehealth platforms to take the consultations, and the care delivery could be done by integrating the system using the telemedicine, telehealth, or tele nursing. And coming to the mobile apps. So the mobile health apps, I think our Gopichandran sir already has done a very beautiful app. So here we can see this is very important because it is going to give us it is going to access the health information. We all know very well, whenever we are using a mobile app, it is going to say whether the data could be accessed. So we have to, it has to access the data. Also, it is going to use because there the smartphones or the handheld devices could be used. So here it's a wireless connectivity and the mobile devices where the healthcare professionals can receive the updates, especially regarding the data. The critical care data could be received for the children. Also, the health tracking apps and the wearables also could be used mainly to collect the data from the child. Similarly, the learning simulations like real life scenarios could be actually we can use the real life scenario, and we can also go with the simulation training. What we are doing nowadays, we are using the virtual learning, no? Like virtual learning is being used, and we are going with the real life augmented learning, and virtual learning is being used, and we are using the real life scenarios. Similarly, the personalized contents. Already, I told you the adolescents are very important because nowadays we can see a lot of problems at drug addiction, and they are not aware of their own problems. So these things, like when you're going to deliver the personalized content, they themselves will know how they can take care of themselves, and they know the follow up, they know the rehabilitation. You can even teach the exercises also, and all the healthy habits could be taught to them. Similarly, it is very important because it's going to be a quicker diagnosis, and it is going to eliminate the errors. There won't be any errors because already I told you one word, precision. So no errors will be there. Similarly, this particular mobile apps are going to be very useful because it is going to be a better patient participation will be there because they use their own apps. So whenever you're going to talk with the patient or the family, they are not going to tell you that you're lying. They say they know that because everybody is using the portal, everybody knows what is happening. So you're not going to hide the truth, and everybody is going to be all are going to become responsible. Even the patients are going to be responsible for the health. The family is going to be responsible. So the patient participation, family participation will be there. Access to the care will be there, and also we can see a parent professional communication interaction will be strengthened more with this. Also, when we talk about the other the top innovations in this, Nutri improves quality of infant care. So this is the Android of which is going to have a clinical workflow. It is going to guide the healthcare professionals, especially whenever the children are admitted in the hospital or they are discharged from the hospitals, like neonatal wards. This could be used. Similarly, data is used mainly to monitor the trends over time. For example, the diagnosis, decisions, what was taken, or what was the clinical management. Completely, it could be that it could be tracked, and completely the data could be, the algorithm could be maintained, and the trends could be maintained, and we can see what is the rise and fall in the trends of the outcome of the child. And coming to the other top innovation, Daybreak Health provides a teletherapy smartphone application. So where the personalized treatment is very important for the mental health. Already I told the personalized content should be given. And TAP's evidence-based care program is very important because that is going to help in stress management and academic performance of the children, which is very important because the schooling, they are going for the school, the education is very important. So that is going to relieve them from the stress, especially children who are having chronic diseases. And these kind of children also we can help with this kind of apps that could be very useful. Similarly, the healthcare professionals also they can have a profile, and this profile is mainly based on the specialty areas, and they can connect the children to the get the treatment based on the specialty what is required. If they need a they have a heart issues, if they are going they're having something related to the lungs, or if they're having a problem with the nose, so depending on that, the specialty care could be provided because that will be linked to that particularly, and we can be able to connect with the treatment. And next one is we are going with the advanced visualization. So when you talk about advanced visualization, the same thing, it is using the AI only, where the augmented reality and virtual reality is being used here. So here the healthcare professionals, surgeons, they're going to completely intricately they're going to see the whole body parts of the child, which is going to be very helpful for them in providing the proper data, that in obtaining a proper data, which is going to be very much helpful in diagnosis as well as treatment. So when completely you know very well that particularly your condition, your what to say, your if you are going to find out from the body what is happening, then it will be very easy to go with the further action, further plan of action and care. So 3D visualization is very important. Nowadays, the 3D, 4D has come, and that is helping mainly in the diagnosis, and the organ defects are very easily taken into consideration for the further treatment. Also, the staff training and child engagement also could be done using this particular advanced visualization because they also will be there. They can have their glasses, they can also go with the simulation, they can also they can also the real situation, they'll be able to understand themselves. So this is where we are trying to go with the AR as well as virtual reality, which uses the real-time environment as well as which is going to use the virtual platform. And also, when you talk about this advanced visualization, it has the solutions like the distraction, pain management could be the distraction could be done, pain and management could be done, health education could be given with this, behavioral therapy could be given for the pediatric care. Also, the therapy could be made fun, and the child also can go with the engaging experience where lot of funny interaction, gamifications also will be there, where the children will be very feeling very interesting to do all this, and they will be like a pain management. Also, they can learn from the funny interaction. They can even learn many things, like whatever is going to be useful for them to know about their own self help. And also, virtual real life medical scenarios are very important because that is going to help, because it is going to develop the skill of the medical care professional before they are going to the real patients. So that will help them to go with a very good skill. So when you are going to deal with the children, we have to be very careful, because when I was doing my masters, or I was in the field, in the pediatric field, we know multiple punctures when we are going to go with IV line. It is very difficult because children will cry, 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 and it is not easy to do it. And immediately we cannot start the treatment also whenever the child is coming with some kind of critical conditions, because when you're puncturing, you're not able to get the line. It will become very difficult. But in this case, because sometimes the people skill depends on the skill also. So when this particular skill is being practiced again and again in the virtual real life environment, naturally after that, when they are going back to the with the real patients, when they are going to practice, they will be able to do the confidence, and the healthcare professionals can completely enable the skill, enact the skill without any difficulty, and that is going to be very useful for the children also. Also, when you talk about the other top innovations, in this case, ARNE, that is ARNE, offers a AR-based vital monitoring system. The vital parameters, the temperature, heart rate, in real time, it could be monitored. So the audio input can be recorded from the clinicians, and that data could be transported. So here, when we talk about the newborn life support protocols, this particular audio input can be used. And when we are going to take the vital monitoring, proper vital monitoring could be done using this AR-based platform, and that is going to be helpful in going for the audio. That is, we can record the audio input, and then that can then be useful in transmitting the data, where we can process the data, especially when we are going to provide a life support for the children. So we need to know the accurate vital parameters, what is needed, what is there, so that we can go with the further action. Similarly, there is another one top innovation, Luna VR. That is virtual reality that is going to deliver a virtual reality based pain and fear management platform. This is so where the child can wear a VR, virtual reality headset, and also that is going to be a age appropriate interactive characters could be seen in that. So the child can interact with that particular characters, which is going to be age appropriate. And I think when we are opening the app itself nowadays in our mobiles or something, whenever we are going with some app, health apps or health platforms or health educational platforms also, we can see a virtual assistant coming, and they are guiding us. Similarly, here also we can have the child can have a headset, and this headset is going to help the child to see the characters, and the different characters will be coming as per their age. So that characters will come, and they will be giving them the instruction, and also they can get distracted, because this kind of one which is going to give them a lot of distractions will be there, and that is going to distract them from the pain. Also, it is going to help them to overcome the fear. So the fear will be totally overcome when they're going to go with this interaction. Similarly, when we talk about another one, that is digestive supplements. So here we are mainly to improve the gut health of the children, as well as the immunity of the children, which is very important, and also improve the child health. We are going with this digestive supplements. This what is digestive supplements? We can see, a lot of protein supplements are also available, but this is different from that, because here it is going to be biosimilar in the ingredients, or that is the chemical properties. It is going to be the same like the supplements. So what happens, even if the child is not taking the breast milk also, this particular functional proteins will be similar to the breast milk. So that is the top innovation is Moalac, that is going to make the plant and animal derived food supplements. So here it is going to be free of any kind of contamination. It is going to be free of any kind of what to say, like if they are going to go with the additives or some kind of things which is going to be allergens. So all that will be free. So the child will not go with any allergens, or there won't be any issues related to this kind of the acceptance to the body. So next one is active pharma manufactures vitamins, minerals, and protein supplements. So it is going to restore the natural functions, where it is going to promote the balanced and healthy life. So here we have two types. One is immuno, yes, that is normally it is going to balance the immune system. Sauce flago, that is going to be an anti-inflammatory support. So if they are going to have any kind of infection in the gut, so this could be used. So this is going to help in clearing the infection. So especially for the gut management, intestinal management, GI management, this is very, very helpful, and it is going to boost the immunity too. And coming to the next one is pediatric electronic health record. So we all know very well, adult electronic health record is already used. So it's a important health informatic tool. So here, when you talk about this digital health record, so mostly it is very visible where we can see the health history, like the vaccinations, illnesses, present history, past history, treatments, all needs to have a visibility. So this particular digital health records will be completely visible. And same time, it is helping into because it can track because it is not going to erase, it is not going to we don't want to make any mistake because it is going to be in a same platform where everybody can visualize it. So what happens? There is chances of the errors will be reduced. So here this is diagnostics will become improved, and it's also going to tailor a perfect care delivery. The proper healthcare delivery can be perfectly tailored and it could be implemented properly because I already told errors could be removed. Also, it is also going to be it will share the data. The simplified data sharing can be done with this, and also it is going to help see when the data is completely available, it is going to be helpful for the future researchers as well as population health management. It's going to be a very good data, national data, which could be nationally we can use this particular data for coming into any conclusions. So the national based decisions on the health, also healthcare decisions could be made easily. It could be done using this particular electronic health records. And it's a digital health record. So here it is going to use artificial intelligence and same machine learning because that is going to give a precision data as well as it is going to help in the precision diagnosis. So here it's going to analyze the electronic health records, and also healthcare providers, they can identify the patterns and trends, how to detect the outbreaks, whatever is occurring, and quickly they can find out, and also they can go with the new treatment. So whenever the COVID-19 pandemic came, it gave us a very good lesson because we didn't know a lot about the digital platforms, but we learned everything only after the COVID-19 pandemic. So COVID-19 pandemic was actually it was very what to say like it was a disadvantage for our country, for the whole globe actually. But still, it advantages. It made people technologically they became very what is a proficient, and also the technological tools and innovations started to get more and more. It started to escalate, and now people are going with a lot of. When we talked about that startups and scale ups have been completely started because everybody is sitting and thinking some new apps, and that is going to be very helpful. Even nowadays, even small children, they're also thinking a lot. Even the children who are having their own health condition, any disease generate some kind of innovation, which is going to be helpful for them. And next, coming to the another top innovation, child health imprints. So this is like it is going to use the cloud-based electronic health records. So it can generate the auto discharge summaries, disease predictions. So here there is going to be one thing called as INICU intelligence, where they can use this particular cloud-based data, and that particular pediatric health electronic health records platform could be used in the NICU. So here it can integrate, mostly it can integrate the clinical observations with the observational like laboratory results, and also it can go with a medical comprehensive reports could be framed, especially using the machine learning. So this will give us a precise diagnosis, and also it is going to give us a precise observation, which is going to go for a proper plan of care. And coming to the another one is Mejo offers a digital child health journal. So this is going to be a web-based journal where they're going to have a complete health data. This is going to save the time. It is going to share with all the medical professionals what to be done. So they can like through the text messages or email, it can be shared to everybody. And with this, they can easily they can find out this is a digital journal where they can know what is like they will be able to completely find out the health data that is going to be present. So this based on the findings, research findings also it could be given. So this will be helping to go with the proper plan of care. Then next one is infant ventilator. So we know very well, I already told it's a smart ventilator, or it is called as a high frequency auxiliary ventilation, HFOV. So it is a non-intensive solutions, or it's more non-invasive portable one. So here it's having a sensor. So it's having a sensor driven closed loop feedback is there, which is going to be helpful in providing the oxygen delivery for the newborn with the conditions, especially if they have a respiratory problems. So here, when we see this is going to be very helpful because it is going to completely save the child, life saving for any critical child or the children who are born with the prematurity. So premature infants also could be taken care by using this infant ventilators because it is going to be portable, which can be used anywhere, and this is going to be completely safe because when you are going to ship the patient, ship the newborn, and it is the timing. We can see there is a lot of time lapse, and this time lapse also is going to completely reduce the oxygen saturation, and which can even cause a death. So to prevent this, we can immediately reduce the time gap, and also the time lapse or gaps could be completely reduced, and we can go with the treatment immediately when we are going to keep this in the bedside. So every children, this could be kept in the bedside of the completely critically ill children, so that if we can predict if these kind of children they don't have any issues also, we can predict some kind of issues, and immediately it could be connected, and this is going to be useful until we are going for a major treatment. And also other top innovations, biodesign innovation labs that is going to make a smart mechanical ventilation device. So it's like we call it as a respiratory aid. So it's a respiratory aid. So it's a low cost, smart, portable mechanical ventilation device. So it's a volume control ventilation, which can be used in the emergency rooms. It can be used in the ambulances also, whenever we are going to shift the patient from the scenario, and also the post-operative care area units where we can keep it. And also this is going to display this particular respiratory respiratory aid or respiratory aid is going to display the vital events like the breath rates, tidal volume, peak inspiratory pressure in real time. Also, it is having a safety alarm. So, in any emergency situation where there is a changes in the vital parameters or anything is causing some kind of problem in the physiological parameters of the child, it is going to give this alarm, and that is going to alert, and this will going to be very much helpful. And next, coming to the another one, that is pediatric rehabilitation technology. So we all know very well, especially in some situations, even after giving the treatment in the hospitals, the child will be taken to the home, and the rehabilitation should be given. The children who undergo surgery, children who undergoes any kind of manual invasive procedures, also sometimes fractures, children with head injuries, or children with cardiac or pulmonary conditions, and they all, like even the children who are having some congenital anomalies for which they are operated, they go for the rehabilitation. So this kind of rehabilitation is very important. So also the children with mental rehabilitation is very common, especially children who are having a cerebral palsy, or sometimes children with we all know very well intellectual disability. So these children, so we need to go with the proper rehabilitation technology. So here also we can go with the children with the disabilities. They can have a function to improve the functional abilities, and also to participate in daily activities. This particular rehabilitation technologies are very helpful there. We can use the augmentative, or we can also go with the alternative communication devices. So this particular, because initially I think we all have talked about the communication bulb and all that for the children. So, but now we don't want to go with that, because all that's all it is all we all know very well, it is a devices. All that is not. So we are talking about the innovations which is minute, and it is not. It's very easily portable. It is very easily it can be carried, and it is not going to cause any kind of discomfort. But other devices, when you see, it is going to cause a lot of discomfort, and it will be completely apparently seen out, which is not easily adapted by the children.
Hello. Hello, Vasanta ma'am, are you there?
Network
I
issues there.
I think some network issue is there. Okay, we will wait for 2 to 3 minutes till the ma'am will join.
Network is not stable. I hope it's okay now.
Yes, yeah, yes, it's
Okay.
okay, ma'am.
I'm sorry, extremely sorry, because it's going down here. And also, we have to foster the immediate care. And very, very important. I'm insisting on the innovations. Mainly, I'm telling saving the time, saving the cost. That is very important, because we're in a fraction of second,
I think again there is a disconnection from madam's side. Sometimes we have to face glitches of being on digital platform, and this is one of them.
Taught from
Again, I think there is a network issue from madam's side. We'll wait for 2 to 3 minutes more, then we'll wrap the session.
and also the platforms which can be used, like we can use the cloud-based storage where we can share the data, and also that could be used mainly for going with the follow-up. The next one is Kiddie RX, that is mainly for the treatment purpose, pediatric telemedicine app. It's a virtual assistant. I think we all know very well nowadays, everywhere we can see this virtual assistant. They are connecting the parents and patients, especially with the licensed healthcare professionals through the video chats. And also timely care delivery is being given for the children. And also the prescription of drugs could be done. So we can do it within a few hours. So it can give the prescription, any prescription, maybe the medicine, or it can be the management modalities could be prescribed through this. So the caregivers could be connected and the timely care delivery could be done with this. And next one is clinical management system. So we all know very well about the health informatics that can be used. So that is mainly going to connect the clinical operations, especially medical, financial, administrative, and legal segments are completely connected, and it is having a broader clinical operations, especially for it is going to make the administrators, it is going to be very efficient for the administrators. The inefficiencies and the errors of the administrators are going to be completely reduced, and it is going to have a single source of truth. It can be a legal record and don't want to hide anything. It is going to be transparent. So this is going to be very helpful in case of a legal and ethical issues. And here, when we see that, we can see it can be used as a clinical decision support system where we can completely deliver the data, especially by the admins. Also, the patient engagement can be completely made where we can go with the relevant information and the proper healthcare delivery. And also, we can combine the health records, medical records, especially with the finances, administrative tasks, and the job can be made very, very easier because it's in one platform where we can combine the data in one portal. And decision making will be very easy because all can sit together in wherever their areas they are, because they can see the portal and they can open it and they can go with the login. They may have their own login details and everybody can open and all can talk then and there and they can solve. The solution could be sorted. So it's a very good lifesaver, and they say even it's a hero. They say the superhero in the particular innovation is the clinical management system. Also, we can see there are a lot of innovations. L3 makes an AI-enabled healthcare practice platform. It is going to combine the online health professional consultation, patient management system, health professional appointments could be taken, e-prescription could be done, health electronic health record systems could be maintained with this, clinical management could be done with this, billing, finance, and also outpatient management can be done by using this, the follow-up. Also, there is A3 Max and AI-enabled healthcare practice platform is very useful because it is non-expensive, because it is an in-house product. It could be done, it can be used by the healthcare organization. So it can be a non-expensive one where they have the platform and in there the IT can be available in the health system or healthcare system, and they can operate this. And also this is very important because it can treat many patients. And also there is one more, that is in Sophia improves patient engagement where natural language conversational AI, because we can use any language. Sometimes the language issues, English. So nowadays there is nothing. We can go with any languages out there. So all the languages, any languages they can handle. The patient can go with the virtual appointment management system. Prescription could be done. The refilling of the prescription. For example, what my medications. So currently, when I was in Ethiopia, I would like to tell my mother, I lost my father. My mother became she had a depression. So from there, I took an online appointment from the doctor, and the doctor, myself and my mother, my brother, all were sitting. My mother was in the Chennai. I was in Ethiopia. The doctor is there in Tinagar. So we all were sitting together, and I think we all in online platform. We were able to go with the. He was able to collect the data and all the history, and he was able to prescribe the drugs for my mother. And also the prescription refilling is being done nowadays using this particular one. Also, the AI is very important because they use this AI because it's going to interact with the patients also as well as the customers, and that is going to become things is going to become very smooth, and it is going to be very easy in working. Also, there is this particular platform is very important because it is going to combine the voice, because it is good. We are getting the audio output. We can see, look at each other now what we are doing in Zoom app. Also, we are able to enable and streamline the communication. It's going to be omni-channel, one channel. Also, there is going to be automated pathways, especially for the pediatric clinics, where the patient engagement, the family engagement, and it's also going to be very profitable for the increase in the clinical profitability in terms of the organization, as well as the healthcare professionals, as well as the patient and family. So other innovations we can see, these are the innovations which has whatever I spoke, it was all because we know artificial intelligence, we know the diagnostics, we know the visualization, everything. But whatever I spoke was all about the current innovation. Similarly, there are many innovations that has been come, and that is like children's healthcare, Atlanta's anemia, where they are having a smartphone application. Also, there is one type of mobile called as Animo Check mobile. So it is going to be when you are going to use this Animo Check mobile, we are going to keep our thumb, and this is going to give us the data about our hemoglobin. Only with the it will read from the fingers, from the nail buds, it will read our hemoglobin, and that hemoglobin level will come in the app. So it's going to be very much non-invasive. Similarly, Texas Children's in utero spinal bifida surgery. We all know very well this particular surgery in 2010 itself they have started. Because where the uterospinal bifida surgery could be done in uterus by opening the uterus, and could be done when the child is in the fetal period itself. That was done in 2010. But now after 2020, slowly they started with a less invasive fetoscopic procedure. That means this fetoscope is used, and they have a small here the incision, because there it was a 7 centimeter incision. Now they are going with only a 4 millimeter incision and less invasive. And also the fetoscopic procedure, the fetoscopy is used in this case, and with the fetoscopy they are going to do the procedure, and this is going to be very minimally invasive procedure. Also, there is another one, that is children's Wisconsin's auricular neurostimulation, where here we all know, whenever the child is having any kind of go with the neurostimulation, what they do, they are going to go with a big apparatus, and sometimes this kind of stimulations are very important. But here, no need to go with that. We are just sometimes for the neurostimulation, auricular neurostimulation, we use many equipments and many articles, many equipments, where sometimes also we try to monitor that continuously. It is also not possible. But here we can use a small battery unit which can be kept. It's like which has a very 4 electrodes that could be attached back of the ear with adhesive. So it is going to be very comfortable, very soft, and not going to create any. So it's a small one which could be kept back. So it is not going to create any discomfort for the child. Similarly, there is another one, that is Seattle Children's Hospital's leukemia treatment, where they have they have taken a very big acre of land and they are trying to produce this, manufacture this chimeric antigen receptor. So this is a T cell therapy, which is mainly used for the acute lymphoblastic leukemia. So this is very important treatment, which is they started with more than 50,000 of area has been covered by producing this particular T cell therapy, manufacturing of this. Similarly, there is Children's Mercy in Kansas and the MUAC, that's tape. We all know very well. In when we all used to use a quack, the tape where we are going to go with the mid upper arm circumference. The color coding will be there and we can do it. But nowadays, they even go for a Z-score tape because people don't even want to stand on the weighing machine. Because sometimes, if you see the people like me, I'm very heavy. I'm very I'm sometimes obese children also there. We feel very bad because sometimes when people are making mocking, or sometimes we ourselves, when we think about our own self health, we feel when the obesity is something. So when I see, whenever people call me to check the weighing machine, I'll be running because I don't like, because if they see my weight and when I see my weight, sometimes it will give us a lot of embarrassment. But this particular Z score, where the tape can be yeah, it is like a mid upper arm circumference tape only. It can be kept on the arm, and that is going to give you your weight. It is going to give the Z test, Z score test tape that is going to give the weight of the person, weight of the child. So another one is anytime pediatric telemedicine. So anytime means multiple people are available in telemedicine. No need to give them the call. No need to tell. Anytime the person can come. Any one or two persons will be always available. So that is called as anytime pediatric telemedicine. Then coming to the another one, that is treating congenital heart disease with the Renata Medical. So this is nothing but a stents, the occluders, whatever we use for the congenital heart diseases. We know very well when the child is and during the time of the birth, when the child has this problem, we are trying to use the device, whatever we are using as occluders. This is going to be it is going to block the particular heart disease, congenital openings. And what happens is, it slowly, when the child is growing, we need to the hole also will increase, and we have to go for the bigger size occluder. Sometimes the what to say, we have to go with the repeated surgeries also. And also another one is sometimes this particular nowadays, though we have a lot of innovations where the occluders are, it's going to be the very one which is very innovative. But still, this particular Renata Medicals has brought about the occluders, which is going to be very small in size. And this particular occluder, when it is going to be put it in the world, it is going to completely bulge. And that complete bulge, as the child is going to grow, this will be slowly, it will be we have some kind of hygroscopic action. It is going to completely expand, and as per the child is growing, this hole will be completely occluded by this very small minute. It's only a 4 millimeter one, which is going to be completely, it is going to expand and occlude, and there is no need to go for the surgeries again. So that is called as Renata Medical. And similarly, there is a rehabilitation technology, already I told previously. So EEG monitoring for the brain activity could be done. Sometimes powered wheelchairs could be used for the children, especially for the rehabilitation, which is going to help them to rehabilitate. Similarly, the virtual reality gaming could be done, where the physiotherapists, they can completely, through the virtual platform, they can teach them the physiotherapy exercises, as well as the occupational therapy sessions also could be dealt using the virtual platforms. Then there is robotic surgery. We all know already the robotic surgery started. So the robotic surgeries, especially in case of heart diseases, and also in case of other surgeries, they have started the robotics. And also the robotics is used in many management modalities. So the super sensors from the robotics, the 3D and 4D ultrasounds are also the robotic utilized modalities, which can be done to completely accurately diagnose. Also, we are able to observations could be done accurately. Also, the children with movement disorders who are already in the wheelchair, the wearables, like for example, we can use the wearables, the robotic exoskeletons could be used, where they can completely wear this and they can they can walk and move with ease using this particular exoskeletons. So they are robotics. So that could be done for the children with especially the children with the ortho disorders. So that is completely who are not able to move at all. They can put this and they can move. So this is a very important innovation. Yes, and because we know the children every children, they need to run and they need to play. So if they're not able to walk, so this will be very useful for the children. They can be independent. Similarly, there are many devices that is being developed and that is being attached to the patient's head, and where they go for an interpretation, they can go with the thought processes. So that is helping them to go with the completely, they can completely go with the brain. The thinking process could be done using this particular devices. So they can understand, they themselves can control the thoughts. So that's what we all know very well. The hypnotic therapy. We know about many therapies that could be done, which can completely control our brain and like our body and our mind. But here, this particular devices can control our thoughts, and this is helping us to completely reduce, for example, the unwanted thoughts, unwanted fears could be controlled, and this is going to be helpful for the person to go with the confidence, and this is going to help in a prognosis of the person, and therapeutically, it is going to be very good. And also there is rebuilding blocks. So where in congenital defects and fetal disorders, there are a lot of rebuilding blocks could be done. And these rebuilding blocks, actually, I already told, no, like Renata methods only. So what it can be, like whatever we are using, the innovations that is very helpful, where it is helping to go with a minor, very small incisions could be done. And also the equipments, whatever we are using, it is going to be very tiny one, and which is going to be very less invasive. Similarly, the new organs and customized prosthetic limbs, where we are using 3D printers. So with the 3D printers, we can completely we can just go redo or remake the prosthesis, and that is the same prosthesis, and that could be fitted for the child, and that is going to be a rehabilitation process. It is going to be very helpful. Similarly, tissue engineering for construction of the tissues, for the construction, for example, accidents or burns. So this tissue engineering is very full because it is going to construct the tissues. Similarly, genomic medicines and like in genomic medicines or genetics, where we are going to completely see the gene therapy, and we are going to find out what is the genetic diseases. Also, we can also know what is the genomic medicines. We can find out what is the condition, the genetically affected condition, and we can see how it could be controlled. So the precision of the genetics also could be done, and we know how to control it and how what to be done. Similarly, there is pharmacogenetics. So that is mainly going for a management of the drugs, where we can select the proper particular genetic condition, what is the particular drug, and where it is going to act, which area it is going to act, how it is active, how it is going to act. So all this could be controlled, and based on the genetics could be done. So the conditions, the genetic conditions also could be controlled by using this. Then smart pill dispensers. So already we know about smart pills. So what are the smart pill dispensers? There are MedMinder, Hero Health, and Pill Drill. So this is going to completely dispense. So it is going to say, we are always talking about the drugs. Till now we say right patient, right drug, right dose. So this could be done by using the smart pill dispensers. So it will give you the right dose, and it is also knows what is the right patient. It is helping us to identify the patient and give a proper drug and right time. And nanomedicine. So we know this nanomedicine era has become very common, nanotechnology, where we are going for the cancer treatments with the nanomedicines, and that is going to be targeting. So where you don't want to see the, whenever we are going for the cancer therapy, the chemotherapy, radiation therapy, we are not only targeting on the particular area, we are targeting on the other areas. But this nanomedicine, only specifically, it is going to act only on the area where it needs the treatment, and the medicine is completely given onto that particular area only, and so that the surrounding areas will not be affected. And also this is going to be very useful, where the complications could be completely controlled. And minimally invasive interventions, so robotics also used for this particular purpose. And digital therapeutics, already I told, digital management, where we are going to manage the behavioral health. So digital platform we can use, and we can manage the behavioral health of the children, especially the gamification is one type of one which can be done. Even I told about the robotics, which can control the thought, that also could be done. So the mental stress management techniques also could be taught in the virtual platform, that digital therapeutics, where we can use the augmented or virtual reality. So others, there are a lot of child-friendly medical equipments nowadays, which is going to help the children. Therapeutic clowns. So everywhere nowadays, I think outside we can see the clowns, which so we can keep this in the hospitals, which is going to make the children very funny, and they are going to see that, and we can give them the treatment. Similarly, art and music therapy, and that could be already it is there, but now it is being going with a lot of innovations. And this art and music therapy is completely, it is going to reduce the allay the fears and anxiety, which is very common in the child and the family. So that is the first priority, which could be removed, and then only the treatment could be given for the children. So we have to go with the psychological and mental health. and the tools that could be used, which comes in digital platform innovations, electronic health records, personal health records, because electronic health records could be handled by all the persons, experts, whereas personal health records could be handled by the patient and family. Patient portal, the patient portal, everything is in the portal. Everybody can come and we can, one time everybody can sit in the portal and they can and see whatever is there. It's like a website. And family-centered care plan. So this is also a digitalized care plan where it could be digitally maintained. E-prescription. So already when telehealth we are talking about the electronic prescription. So pharmacy also has pharmaceutical health systems are also available where we can go with the e-prescription. The doctor is prescribing, everything can be done at the same time. No need to search for anybody. No need to go to search. No need for the pharmacist or nurses to be there. Everybody will be in the same area platform and virtually it could be done. And tracking, e-tracking. So whether the patient is they given the medicine, whether the follow-up is done, whether he's taking the medicine properly, all the tracking could be done. The adherence, especially when I told about the pharmacogenetics, I need to tell that it's mainly talking about the adherence. We know whenever we are talking about the TB, HIV, and other medications, whatever is there, and especially children with chronic diseases and disease condition, they'll be repeatedly taking medicine. Not very easy, like adults, to make the children to take the medicine. It's not very easy because adherence of medicines are very important because we have very importantly, especially when they take antibiotics. We know antibiotic resistance is a common problem whenever you don't have a proper compliance. So to go with the compliance, the e-tracking, pharmacogenetics, and all that comes into for the genomics comes into play. So coming to the conclusion, we know innovative therapies are not only improving the medical outcomes, but also they're enhancing the overall experience of the children and the family. So very well, it is like as the field of pediatric healthcare continuing, and we are embracing a lot of innovation. The future is holding, it is like a promise for everybody because we need to go with the personalized, because everybody should have their own self-conscience about their health. Effective and compassionate approaches should be there to treat the children, especially by the child as well as the family, also the healthcare professionals. So all should come into the same area, so where we can ensure a best possible start in life, regardless of the challenges. And also, when we talk about this, the pediatric nurse plays a very important pivotal role because nowadays the nurses are very important because they are researchers and they are the scientists where they are bringing out a lot of innovations because they are the apt person. So more than the physician, I say research nurses are the best researchers and best innovators, and they all can use the evidence-based practice because they're always in the practice area. Continuously, they can use the EBP and they can find out a best solution for the children with a lot of researchers. So here, to have a healthier today, happier tomorrow for a child who is going to be we know very well today's children are tomorrow's citizen, and we have to make this young minds to become a stronger ones in the future. We need to go with a lot of innovations, and pediatric nursing professionals are the pivotal agents or the key professionals who are completely responsible for this particular innovations and patents. So with this, I would like to say the quote that patent age is very important because we are going with a lot of new innovations and inventions that is going to kill the bodies. For example, the bacteria all are thrown out and we are going to save the souls. So all propagated with this particular best intentions are very important. So all need to go with the innovations. Everybody should think of some innovations that we need to do. That is the child-friendly innovations could be done. So I am with that. Once again, I would like to acknowledge this because it's a great opportunity for me. And extremely sorry for the interruptions because in Goa, I'm having this big issue. That's why I didn't go from my house. I didn't even start to my house. I'm sitting in the college only, but still I have this issues here in the college also. So sorry for that, first of all. And I would like to offer my acknowledgement to my own management for the support and Society of Cardiac Nurses India, especially to Gopi Chindran sir, my is a great personality, who is my guide, who is a very good mentor for me. Also, the Nurses Teachers Association of India. I think this is not a first one I'm doing for them. I'm doing many NTA. I've done a lot of webinars, and I'm in connection with them. I'm future also I'm expecting I'm anticipating a lot of connection with the NTA because this is helping us also to share our knowledge and also to make us also more, because it's making us also more proficient. Whatever I don't know, I know many innovations, but today's innovations, whatever I brought, is all current innovations. And that opportunity was given by Society of Cardiac Nurses as well as NTA to learn myself. So self-learning was done by myself and I have shared it with everybody also. Thank you so much. And thank you, Farooq and Poonam and Maria Madam, as well as Monica and Joshna, also Neeraj sir for all this. And thank you so much once again for this great opportunity. Thank you. Thank you, audience. I think in the evening time, I think you have spared your time. Thank you so much once again. I would like to, whomever I missed, I would like to acknowledge my thanks to everyone who is here in the platform, who had arranged and organized this particular great event and great academic and scientific event. Thank you so much. Thank you. If there is any
Thank you.
clarification, you can ask or you can even write to me.
Yeah, thank you. Thank you so much, ma'am, for such a wonderful, excellent, elaborative, innovative, and updated session. Definitely, our participants have been motivated and gain a good knowledge from you. And definitely, it's like amazing, amazing. When I heard your session, so much of innovation was in a pediatric field, and we were not even aware about it. So, thanking so much for making us aware about this thing. And definitely, we are obliged to you. And yeah, we too sorry for you that you are being sitting at your workplace and not even at your home for us. Thank you. We are definitely obliged to you for your kindness, ma'am. So the session is open for question and answer. So participants can have the questions, any queries, it can be clarified from the ma'am. So you can start with the question and answers. I think, ma'am, there is no
Two
question
persons
answer
have
for
raised
you.
their hand.
Means like it was such a good session
Some
that
two
whole chat
persons have
box.
raised their hands.
Ha, ha, ha.
Anybody? I think two persons have raised their hand. If you have any questions, you can ask me. Otherwise, you can write to me also. No problem. I can tell you.
Yes, please.
I think
Whosoever is having any query, please raise your hand or can ask directly. Ma'am, whole chat box is filled with thank you, excellent session, nice session. Thank you, ma'am. I don't think that they have any query. All
thank
the
you so
queries
much.
are being cleared.
Hope it has been clarified. I think it's all very good one. I think everybody has to go because it was a very good. That's why I told now I'm thanking NTA and Society of Cardiac Nurses mainly for this particular opportunity because I have updated myself with this because though we are updating, this was an elaborate update what I took today and it was not a one day work. When sir started, Gopichandran sir told me from the day I started to sit and work on this and this was a elaborate knowledge what I gained myself which I shared with you all. So it was novice to me also. Thank you so much.
Ma'am, only one question came that is there any hospital in India where this innovation have been implemented?
Yes, nowadays we are going with AI. AI with all the AI. I think virtual platform is very common, and commonly it is appearing for everybody. Even wherever you are sitting, you can do it. Telenursing and telehealth. I think telenursing is not it started, but telehealth has started. Telemedicine is there, so it is available. Many hospitals in India they started with this tele. That is after the COVID pandemic. It has been very common. So the virtual platform usage and AI robotics. I think minimal invasive procedures, robotics are also started. So the machine learning is coming into progress. I think all the engineering persons who are coming into the health, they are collaborating with the health persons and they are doing this particular with the machine learning and deep learning. They are going with the precision in the diagnostic modalities. So it
Hmm.
is already started.
Okay. Ma'am, one more question. How we can immediately manage meconium stained babies?
Oh, okay, meconium. Whenever you see meconium stained babies, actually, I think well, I would like to give this question. What is the response to you only? Because I know only I told we have to go with a lot of apps. When I spoke about the hyperbilirubinemia, I told the bilirubin monitoring is being done with a particular innovative app. Similarly, I think the meconium stained babies also we have to go with some kind of technology which we need to find out. So I think, but in the innovations, we couldn't find. But the normally whatever we are going to do that only we are going to do but the innovations I think I'll give this to the person who asked the question. You have to think over and you have to find out because already the innovations I have just enlightened. You see what we can do for this.
Yeah, definitely. I think it's a gray area and we should come forward and we should work on it.
Yes.
Definitely. Yeah. So with this, I think we come to a session. No more question for you, ma'am, except only thanks and excellent session. So thank you, ma'am. Definitely we'll be associating with you in future programs and all.
Thank you. Thank
Thank
you
you,
so much.
ma'am.
So once again I thank Society of Cardiac Nurses and NTA and CBS Publishers. I want to thank them for this great opportunity and for the collaboration. Thank you.
Thank you. Thank you so much. Thank you
Thank you,
all of
audiences. Thank you. Thank you, my dear nursing professionals. Thank you so much.
Thank you. Thank you, participants. Thank you, CBS Publisher. Thank you, Santa ma'am. Thank you, NTI, Dr. Farooq sir. Thank you, Poonam madam. Thank you, Mariam madam. Thank you, Society of Cardiac Nurses and the team. Thank you, all of you. We'll meet next month again with the some new trends.